Hello guys, welcome to SK Classes NZ again. So in our previous video we have already discussed about the hypertension, that what is hypertension, what are the main stages of hypertension, and what are the main warning signs of hypertension from where we should know that this patient or this person is suffering from hypertension. So now we are going to discuss about that what type of treatment as well as what type of diet that should be given to the person or the patient who is having a high blood pressure, so that his or her blood pressure that should be controlled on the spot. So let's discuss about the treatment as well as the diet that to be provided to the patient. So if we are talking about the diet, so the diet that should be provided to the patient if he or she is suffering from high blood pressure, we always kept in mind that the diet must be having a less salt in it. Okay, because if the patient is taking lot of salt in his or her diet, so it's natural that his or her blood pressure will gonna high if he is already suffering from hypertension. And apart from this, we can also suggest a person to opt for high fiber food, means he or she can take high fibrous foods like salad, green vegetables. Okay, and natural potassium, it should be must in his or her diet. Natural potassium means he or she can take a lot of fruits which contain lot of potassium, especially the colorful fruits. Okay, so this type of diet that should be recommended to the patient if he or she is suffering from high blood pressure. Now see in this picture is showing that what type of food you have to eat and what type of food you have not to eat in high blood pressure. Okay, so like berries, oatmeal, dark chocolate, green leafy vegetables, garlic, bananas, olive oil, red beets, yogurt, and salmon fish. So these are the food that you have to eat if you are having a high blood pressure. Means that your diet should be your diet should be according to this. Okay, and what type of food you have to avoid if you are having a hypertension, like red meat, you must avoid fast food, alcohol, sweets, canned beans, bacon, table salt that I already cleared you, whole milk, canned tomato products. Okay, so these type of foods you have to avoid, or in simple words you must avoid fast food or spicy food. Okay, and try to you can say stuck or on the fruits, vegetables. Okay, and the especially the food which are or the fruits which are having a maximum potassium. So this type of diet that you have to follow if you are suffering from hypertension. Beside this, you have to, like you can say, you have to eat a healthy diet who is having less table salt. Okay, and you have to do the regular physical activity or regular exercise. Then you have to maintain like a healthy weight. Okay, means if you are obese, you are having obesity, or you're fatty. Okay, you have to lose your weight so that your blood pressure will not gonna high. Then if you're taking alcohol, so you have to control your alcohol. Okay, and if you are a smoker, so you have to quit the smoking. Okay, and one thing which is must, you have to take 7 to 9 hours of sleep daily. And if we are talking about the main medications, so the drugs which are given to the patient, they are known as antihypertensive drugs, and these include many classes. Okay, and first one is your AC inhibitors, that is, you can say choline converting enzyme inhibitors. Then beta blockers are there, calcium channel blockers are there, and your diuretics are there. All these classes of drugs, they helps to decrease the high blood pressure and decrease the stroke volume, and helps in the production of urine, or you can say helps in diuresis. Means if the urine production will be more, so there will be less pressure, and the blood pressure automatically gonna high. In your diuretics, loop diuretics are there, potassium sparing diuretics are there, for example your furosemide injection, lasix. Okay, so all these medication that you have to take, and but you have to first consult with the doctor. Without the consultation of doctor, you are not allowed to take all these medications. Okay, and if doctor has prescribed you all any of the drug, that you have to take daily. Okay, whatever the time is given by the doctor, that you have to take once, or you have to take twice, or you have to take thrice. Okay, that depends upon your prescription. But if the patient is having high blood pressure more than 180, so in that situation, emergency medical treatment or emergency critical care, that should be must, and the patient has to bring to the hospital. And in the hospital or in the ICU, doctors always try their best to give them good medications as well as treatment. And most sometimes they started like infusions of lasix, or just to control the blood pressure of the patient. So this type of treatment that should be given by the doctors. Okay, but what you have to do in at your level, you have to control your diet. Your main focus that should be on the diet. Okay, and medication or what type of drug you have to take, that is the, you can say, the doctor's order. Okay, means whatever they prescribed you, you have to take that drug once, twice, or thrice, but you must focus on your diet. So this is all about the high blood pressure. And in our next video we will discuss about the main complications of high blood pressure. So till then, thank you for watching SKK Classes NZ.